Good afternoon, good morning, good evening, wherever you are in the world, and welcome to today's Talking Tech. Thank you for joining us. I'm Army Veteran Dan Hunter, a communications specialist in the Office of Information and Technology, and your host of this series, Talking Tech. So, wherever you are, take a seat, prop up your feet, enjoy today's discussion, and send out a tweet. Like, share, and comment throughout the show. I have an interview to do, so let's go. This monthly series gives VA technology experts an opportunity to share what they're doing to serve our nation's veterans. They'll discuss best practices, strategies, and techniques designed to enhance the veteran experience. VA uses ones and zeros to help our nation's heroes. Today, I have a unique opportunity to reverse roles. Normally, when I go to see a doctor, they ask me questions. Today, I get to ask questions to two doctors. We have Dr. Helga Rippen and Dr. Ken Berkowitz. So, with that said, would you both introduce yourselves and talk about what you do for the Department of Veterans Affairs?
Sure, I'd love to. And hello, everybody. My name is Dr. Helga Rippen, and I serve VA as the Chief Interoperability and Veteran Access Officer here in the Office of Information and Technology. And in 2019, I helped bring together a group of senior leaders from across the VA to support VA's mission by ensuring that all steps of the veteran's journey work seamlessly through interoperability. And therefore, we created the VA Interoperability Leadership Team that we lovingly refer to as the VAIL to direct and measure VA's efforts to ensure seamless and secure interoperability, aligning business, information, and technology ecosystems. But interoperability helps us bring information together, and that requires clear guidelines to help us make decisions about when we should or shouldn't make information available. And I have the pleasure of working with Dr. Berkowitz on VA's Data Ethics Working Group, which is now part of the Data Governance Council. Ken?
Hi, everybody. I've been so looking forward to this and exchanging ideas and sharing our thoughts with the IT community. So thank you for having us, and I'd love to help hear what you think later on. As Dr. Rippen and Dan said, my name is Ken Berkowitz. I am a senior healthcare ethicist at VHA's National Center for Ethics in Healthcare, co-chair of the Electronic Health Records Modernization Council, and as Dr. Rippen said, VA's Data Ethics Work Group, which is a standing work group of VA's Data Governance Council. My career in healthcare ethics is focused on promoting ethically strong healthcare practices in VA, mainly VHA, standards for and quality assessment of clinical and organizational ethics consultation, ethics education, and very relevant for this call, data ethics. In July, VA codified in regulation VA's principle-based ethics framework for access and use of veteran data, and it was published as a final rule in the Federal Register. VA's framework is one of the government's and tech industry's strongest statements on ethical data practices for and access to sharing and use of veteran data.
Well, thank you both for those introductions. Uh, you have a lot of experience, a lot of education. What brings you here, and more importantly, what keeps you here serving our nation's veterans?
Well, that's a great question. I think what keeps both of us here is our commitment to support the health and wellness of veterans, beneficiaries, and their families. And we want to ensure that their information is managed transparently and appropriately and is available to clinicians to provide quality of care and others who use data. And that's true whether they're seen at DoD, VA, or in a civilian healthcare system. As far as my story, a little bit briefly, I'm a pulmonary critical care and internal medicine physician by training. I'm also a trained healthcare ethicist. I'm now in my 40th year with VA, which my kids find hard to believe. You worked in one place for 40 years. And really, what keeps me here is VA's mission and the ability to work in a system that's veteran centric and has leadership support to help folks do the right thing. Dr. Rippen?
Well, thank you. As an engineer and a public health and preventive medicine physician, I've really focused my work on leveraging technology that has the biggest impact. And yes, with many of you out there in the audience, we all have a little bit of a bias potentially, which is informatics. And given that my family has a robust history of serving this nation, it's been really natural for me to jump at the opportunity to work at the VA on interoperability, a core capability that we need to support VA's mission and therefore the veterans that have served us. Having worked in leading the development of an international e-health code of ethics, it was important for me to ensure ethics was incorporated into our interoperability activities. And so I'm just really excited to have the pleasure and the honor of being at the VA and also having the opportunity to work with Dr. Berkowitz. Back to you.
Well, thank you both. Can you talk a little bit more about the overarching ethical framework for all individuals and groups and entities, both inside and outside VA, to apply when managing data access to or use of the veteran data?
Sure, happy to kick that one off, Dan. Uh, VA's ethics framework sets the enterprise standards for individuals, groups, or entities who are accessing, using, or sharing veteran data. Look, think about it. VA really, in so many ways, has unparalleled data. And there's no question that as a system, we must achieve the potential of that data to promote innovation and organizational learning and make things better for VA and for veterans. It would be irresponsible not to do that. But how we use our data really, really matters. And for me, this framework, codifying this in regulation, marks an important step in what's been really a more than a decade long effort for me personally. People kept coming to our ethics center asking for ethics guidance. They could do something technically and legally with veteran data, but they wanted assurance that it would be ethically acceptable. They recognize that just because you can do something doesn't always mean that you should do it. And people want help in deciding how best to proceed, how to balance, if you will, protection and overprotection. Building routine and meaningful ethics thinking into our practices gives people space to think about the best way to use our data in ways that we can all be proud of, that will promote trust in VA so that veterans and other stakeholders can understand and champion our data use. People should be proud of it and there should be no secrets. Dr. Rippen, anything to
Yeah.
add?
Yeah, just building on what you're saying, it's really a framework that's really kind of an organizational best practice in ethical data management and use. And it applies to all the VA initiatives that we undertake, be it data or even some of the modernization programs like the electronic health record, and really expanding access and use to new applications to best serve the veteran. So thank you. Back to you, Dan.
Okay. With that said, talking about the ethical framework, how do the ethics principles reinforce VA's standards of data privacy and protection? Because both are very, very important. In addition to having that access,
Yeah.
protecting that information is very important.
Yeah, no, Dan, you said it perfectly. Again, VA has really been a leader in this. VA standards for data privacy and protection really ensures the safeguarding and respecting the sensitive information of veterans, their dependents, and beneficiaries, and an indispensable part of VA's mission and always has been. That means ensuring that their data remains safe, uncompromised, and used only for the intended purpose is really a top priority for every VA employee and contractor. Now, the 9 ethical principles really builds on that, which really governs the expectations for access and use of the veteran data. For example, for the good of the veteran, enabling the meaningful choice, the transparency of use, ensuring that there's no re-identification, providing reciprocity, ensuring security, quality, and integrity of data, and allowing veterans to access their information and also to request amendments. So we really need to ensure that the consistent application of kind of this core component, which is the privacy and security, to the ethical principles will really help us ensure the integrity and trustworthiness veterans and other stakeholders expect and actually deserve when veteran data is accessed and or used. And with that, Dr. Berkowitz, anything to add?
No, I think you guys really said it all. And again, it's aligning VA's mission and values with veterans' priorities and agency priorities as we go in a consistent and purposeful way. And if you hear background, I'm in the middle of a deluge with a lightning and thunderstorm, so I hope it's not too loud.
I hope the most important thing is your safety. So we hope that you're safe where you are. What I want to ask is you mentioned that you've been here at VA for quite some time, and I forget the exact number of years, but you've been working with in the ethics community for throughout most of your career. Can you talk about how you were able to build this house, build this framework to get things started? Because I know that, as in all organizations, and I guess the larger the organization, the larger the challenge. How are you able to build the framework yet overcome the challenges within the organization?
Well, I guess I'll just start and by building on what Dr. Berkowitz said originally, right? Um, his center of ethics has been kind of like a core, I guess, guiding light for the VA and VHA. And, with the continued request with regards to how do I make decisions about data, and again, focused on health, there was a lot of work that his team had done with regards to what are some of the principles that we should consider. So we had that amazing work in place, and it was kind of an opportunity that actually just the timing worked perfectly. We started off with the veil, where we knew that we need to have ethical principles in place too. And so we joined forces, expanding the scope beyond health to all VA data relating to the veterans and caregivers and beneficiaries. And actually build on that. We had amazing support from across the VA. And I think oftentimes one would think that one would have difficulty moving things forward. But you have to remember that the VA is a really amazing organization, and they have the kind of core kind of framework of behavior, the I care values. And I think that it really came to life to highlight why Dr. Berkowitz and I, as we moved forward these principles through the review process and everything else, actually we were given a lot of positive reinforcement and even strengthening some of the principles as it went through kind of the review process. And, it was quickly supported by the Secretary of the VA, and again, made into a regulation in a pretty quick, time frame. I think the challenges are really going to be moving forward as we look at mechanisms to educate and implement the principles. And Dr. Berkowitz, do you want to maybe talk a little bit about kind of that?
Sure. I'd also like to point out to people, because they may think, well, why do we need this? Because we already have other standards, and this principle-based way of thinking is meant to work in coordination and doesn't supersede the other laws, regulations, and policies that also set essential data access, sharing, and use standards. But those other frameworks, those other things, laws, regulations, and policies, don't always give clear direction to VA and its partners how they should manage data usage. A lot of times they say, well, you can do this, or they point out that there's would be organizational discretion to proceed. But that, again, then people were saying, okay, so we can proceed. Should we, as I've already said? So I think this is adds to it, and it nests into those other standards, and they work beautifully together.
With that, you mentioned talking with partners. How have you communicated, coordinated, and tried to get the partners to work with you to ensure that the framework's in place and people are learning more about the standards, the ethical framework?
Well, that's a great question, and I think the first thing was really important to set the standards. I mean, we couldn't expect people to stay in bounds, if you will, if we didn't let them know what was in bounds and what was out of bounds. So I think that's what we've been working on up to this point. And now we're getting the word out there, and we're working with groups and with individual use cases to see how to apply these principles. As I've sort of alluded to, that data use is evolving at an unprecedented pace. That's not a secret for this audience. And when you combine tech advances with new and exciting sources of data and increasing cooperation between agencies, groups, and entities, you have unprecedented growth and potential. But again, also a recognition that this has to be achieved within ethical boundaries if we're really going to be able to achieve the full potential of the data. And if we stray out of bounds, there'll inevitably be some sort of a scandal, or the whole system will grind to a halt and subject to scrutiny and external oversight. And I think that if we can instead demonstrate our own responsibility and our own desire, we can build trust in the system. One of my favorite quotes comes from Stephen Hawking, and I like it so much, it's so powerful that I put it in my signature block. He said, "Our future is a race between the growing power of technology and the wisdom with which we use it." And I think that's the phase that we're in right now. Dr. Rippen?
Yeah, and building on it, when you think about how are we implementing and how are we moving things forward, I think it's important to know that we're embedding things into contracts and scopes of work to really ensure that we all are aligned with the ethical principles and how we should be moving forward. I think it's really critical that especially for all of you to step back and think about how do you actually build systems that incorporate ethics by design. I know that security is a good example. I learned way back when I was with an organization that took security very seriously, that security, it's you can't do a wrapper. It actually has to be embedded throughout the system to really provide security. And now we all understand why that's so critical for at a variety of levels. When we think about ethics, it's the same thing. How do we actually enable these principles in a way that actually can support them, which really requires all of us to start thinking about the design of systems, whether, how do we enable people to give real meaningful choice and permissions and things like that. And then OIT is already implementing many of these, for example, embedding them in the intake process for things like the API Lighthouse activities. So again, all what we see is really an embracing of kind of how do we do the right thing. And I'm looking to watch all of you actually continue to do the same thing. So with that, I'll give it back to you, Dan.
No, Dr. Rippen, what you said is very important. And we have talked with folks who we talked about accessibility and baking that in at the very beginning. We talked, and I've been a part of organizations as well, privacy, security, getting all of that included at the very beginning and not as an afterthought. And usually the afterthought is dictated when something goes wrong. So if we're doing everything up front to help protect data and to ensure that everybody's doing the right thing, applying ethical standards to what they're doing to help protect that information, it's very, very important to the mission, and it's very, very important to our success. Now, there's a lot of what I call entrepreneurial opportunities where organizations, contractors will support VA there's a lot of opportunities for them. What do they need to have, or what should they have in their toolkit in order to seek opportunities with the Department of Veterans Affairs?
Well, I think to start, I'll just jump in. A really true understanding of the principles, right? And when you think through kind of where data analytics and AI might take us, also. So, how do you really enable transparency as far as how information is used? Right. If you're going to be designing a system, how would that really work in a meaningful way? If we start talking about the ability to review information, the ability to provide approval or not, um, is a really important one too. And then, and then if you think about what can you embed as a tool, right? If you're an entrepreneur, if you want to be able to embed kind of a software plug, right? Or an app for that. Is there opportunity there that could actually help in some of the um, um, kind of principles, enabling some of the principles? So I would recommend that you all stretch a little bit. And the other thing I would like to ask all of you to consider is the idea of reciprocity. I think VA is really being a leader here. And what do we mean by reciprocity? That means that if you are able to benefit because of veteran data, then you have to give back to the veteran community that actually served our country. If you think about the work that you might be doing in a community, that you have access to data, right, about the community, how are you giving back to the community? So again, building kind of a culture across the informatics community, I think is an important thing, not only for the VA, but I think as you think about your organization and its role. And I know, Dr. Berkowitz, you probably have a lot more to add. For example, the Million Lives campaign, where people said it was hard to do something, but we could do it.
Yeah, I think we lost Dr. Berkowitz.
Oh yeah, I guess
Dr.
he got.
Berkowitz, are you out there?
He says, "Am I back?" Yep. So what I think I will fill in with his story then. Okay, and I will channel the best Dr. Berkowitz I can only hope to achieve, which is sometimes we think things are too hard to do. And for example, the Million Lives campaign for cancer, where, oh, we can't actually ask veterans to participate or not, right? It's too hard to get, approval, or that people wouldn't actually participate. And actually, we've been extremely successful. So sometimes we think we can't do something even though we haven't tried. And I think that really is an example of doing the right thing actually enabled you to do it, and to do it in a way that actually reinforces kind of our core commitments. So not everything in life is easy, and I've always learned that it's harder to do things up front, but it actually makes it a lot more cost effective down the line, right? But we're only looking sometimes at what the immediate challenges are. So I
Right.
think that would be some of the thoughts that Dr. Berkowitz might have shared.
Yeah. And when you're talking about the immediate challenges and talked about how you got here to where we are today and getting those ethical principles codified and letting the public know about it in the Federal Register, and we're doing things like this to talk about it. What does the future look like in the ethics community, in particular, what we're doing here in the department?
Yeah. Well, we have a brave new world, right? New technologies, a lot of really exciting things. People are really enthused about, oh, if I can bring these things together, be they researchers, entrepreneurs, and others. And I think, again, given that it's new, sometimes we don't have roadmaps that we need that are kind of like, here's where you should be in between. And actually, it was similar to when we went through the whole revolution of online, right? Being online and having the internet, and why we actually even created things like the E-Code of Ethics, because people were putting in health information without any guidance of what is the right information to put in, and you're responsible for the quality and the correctness of that information. Well, it's the same here. We now have kind of this big data, new tools, all these kind of opportunities, but we don't have the frame of how to do it in a thoughtful, acceptable way, right? What are the guidelines? So that would be something I would just throw in. And Dr. Berkowitz, I didn't know if you heard the last question.
I did not. Am I back for sure?
Yes.
You are looking good, sounding loud and clear. But what I wanted to ask was, we talked about how things got to where they are, how you build up to where we have codified the ethical framework, where you have a lot of things that you have done to get to where you are. What does the future look like? What does the future look like in terms of how we are going to apply the ethics principles and ethical principles, and looking at the future as improving or adapting with the new tools and techniques and applications and innovations out there?
So I think it's a really important question, and I like to think of this as a dipping the ethics tea bag into the data culture and having it infused, because there's almost an infinite number of use cases, an infinite number of things that VA does and should do with its data. Everything from research, teaching, quality improvement, sharing data for clinical care, and I could go on and on and on. And as we do that, we need to make sure along the way that people get used to thinking of ethics not as a barrier, but as a necessary component to make sure that we're doing things the right way. And I said before, we must maintain trust in how we use our data. We need transparency. I know this is one of the Secretary's important values, and there should be no surprises. Veterans should know what we're doing with data, should be comfortable with it, and in fact, they should be champions of it and proud of VA, and feel like that they're part of something, and that we're using data to make things better and to promote learning, innovation, health, and wellness for veterans.
Well, thank you both for participating and taking the time out of your schedules to work with us with Talking Tech. We greatly appreciate it, and our veteran community greatly appreciates what you are doing. Spending 40 plus years in the Department of Veterans Affairs and serving your family, serving your nation. We greatly thank you so much for what you're doing to our veteran community, for our veteran community, for the department, and what we're doing to help our nation's heroes.
And thank you for your service.
Yes, thank you and everyone. And again, I apologize for my technical difficulties. I have a new saying: you can't do anything about lightning strikes.
and Dr. Berkowitz, I tried to channel you.
I
tried. Yeah.
Well, keep us informed. Keep us informed about future updates, and we will look forward to talking with you about any updates you have in the future. Thank you for joining us. As you know, VA uses ones and zeros to help our nation's heroes. Thank you for joining us, and have a great